long-term implications of a brain injury. Today on Joe Knows Brains, I'm going to go into kind of the longer-term side effects and symptoms and ongoing persistent issues that many people who've suffered from brain injuries unfortunately have to go through for weeks, months, or even years, or possibly the rest of their life. This topic is going to be covered. I'll cover it in a couple different ways. The first is how brain injuries can affect all of the senses to varying degrees, and what those effects would be. The second is one of the most common side effects of brain injuries. We'll talk about that. And then the last is it's kind of similar, both secondary impact syndrome and what's known as post-concussive syndrome. And these are both two of the more serious post or long-term implications and the cause thereof. So turning first to kind of the long-term implications that brain injuries can have on the senses, as we all know, there's 5 senses: touch, vision, hearing, scent, and taste. And we all of these can be affected by a brain injury, especially based on the area of the brain. As you'll recall, I spoke in the last video about the different areas of the brain and how they affect different senses. And this is where we see how the different areas of the brain can cause different symptoms. So the first we'll talk about is touch. Touch is, of course, your ability to feel and interact with the environment around you. Unfortunately, for a certain percentage of brain injury sufferers, their injury can result in lack of sensation, commonly called peripheral neuropathy, in the hands, the feet, the appendages, and then this can go from as small as numbness and tingling up to a complete lack of ability to detect the environment around you. This can be really dangerous for people because a lot of people who suffer from this symptom can't feel hot or cold, for example, and don't recoil in pain. This is obviously natural progression, evolutionary response, so that way we don't accidentally burn our hands or freeze ourselves, these kinds of things. So that can be a really serious issue for some people. Turning to the sense of smell, this has actually been talked about a lot in today's day and age, especially in light of COVID, which is very commonly causing people to lose their senses of smell and taste. I do know someone who has unfortunately lost their sense of smell, and their sense of taste has been drastically altered. Now, that's as a result of COVID, not as a result of brain injuries. What I will say is the loss of sense and taste is one of the lesser likely symptoms associated with brain injuries. With respect to smell, the inability to smell really, it's actually very often overlooked. So it's unknown if it's actually less common or if it's just less diagnosed, because not weirdly, but compared to every other animal in the animal kingdom, human beings don't really rely on their sense of smell as much. But of course, there are many things that a sense of smell is used for. I mean, it can be as innocuous as smelling freshly baked bread, or as serious as smelling mustard gas or that scent of raw eggs that has to do with gas leaks, and or maybe even smoke because there's a fire in your house. Like I said, this is one of the less common injuries and one of the less commonly reported long-term implications, but it is something that is associated with brain injuries. The same thing is true with taste. Again, COVID reports that a lot of people either lost their sense of taste or sorry, everybody working in an office, lost their sense of taste or had it drastically changed for foods that they may or may not have really enjoyed. They no longer enjoy. Turning to loss of hearing, this is actually one of the more common brain injury implications. But again, these are very severe symptoms to have, especially in a long-term scenario. Loss of hearing is associated with, most commonly on the low end, tinnitus or ringing in the ears, or the reverse, which is an extreme sensitivity to sound. And this can be demonstrated in 2 different manners. The first is when a brain injury prevents the brain from processing out background noise. And the second, when the brain is no longer able to adjust the volume of sounds that it hears based on, I'm not sure the science exactly, but basically we're able to adjust so that a loud noise, unless it's sudden and unexpected, it's able to be toned down a little bit in the brain. But for some people, these loud noises can be extremely off-putting. and be extremely distracting and really change their lives. They're no longer able to hear in a crowded room. They're no longer able to interact with people in the same way they did. Concerts become impossible. This is a fairly common scenario that we run into here at Jim Dodson Law with our brain injury clients, is that hearing is no longer the same in one way or the other. Either they can't hear anymore to some degree or another, and that causes problems, or they hear far too much, and that also causes problems. The next effect, and this is again another very common one, is loss of vision associated with a brain injury. Obviously, blindness is a symptom that can be associated with brain injuries. It is a very serious one, as is deafness. This is one of the harder topics because it's very hard to diagnose when it's not a serious change, either through significant blurred vision or through complete loss, total loss of vision. Both of these things can really be incredibly detrimental to someone's life and really demonstrate a very serious brain injury has occurred. Turning now to one of the more common that's being researched as we speak, one of the more common things that people are starting to experience long term after even what would be known as just a concussion. You know, we've talked about mild versus moderate brain injuries, so never to talk one down, but sometimes people are seeing the symptom even when they're not demonstrating any other symptoms once the rest of their concussion symptoms have resolved, and that's post-traumatic narcolepsy. Narcolepsy, for those who don't know, is the sudden onset of drowsiness at unexpected times throughout the day. Many people associate narcolepsy with daytime sleepiness or excessive daytime sleepiness. It's often tested for. It can be a very dangerous condition, and I have represented clients with this problem. It's very tough because these people can fall asleep anywhere. They can fall asleep in front of a hospital. They can fall asleep at the wheel on a bicycle. For many of them, driving becomes something they just simply cannot do anymore. Or riding, or really even something as innocuous as making toast. There's a story going around where a gentleman fell asleep while he was making toast and ended up having to build a whole new house because unfortunately he just was never able to get back to it and was unable to care for the house in the way that he did prior to the narcolepsy. These lifestyle changes can be permanent. Kind of turning to the next issue, which is post-concussive syndrome and an associated condition known as secondary impact syndrome. Well, they're not necessarily associated, but you'll see why in a moment. So once an individual suffers a concussion, for about 90% of people, 85 to 90%, their symptoms will dissipate over about 2 weeks to a month. For some, it can take as long as 6 months, and for some symptoms, it can take up to a year. But pretty commonly amongst neurologists who treat TBIs, they'll tell you that after a year, any symptoms that remain are considered permanent. And that condition of having these concussion symptoms far longer than to be expected is known as post-concussive syndrome. On the short term, this can occur most often in what I'm about to talk about, which is secondary impact syndrome. So once a brain has suffered a concussion, the body's going to respond with certain healing mechanisms. One of the main things we can do to promote healing after concussion is, of course, getting more sleep and avoiding blue screens to the best that anyone in 2022 can avoid a blue screen. A secondary impact syndrome is essentially that while the brain's doing this healing process, it is much more vulnerable to a second impact. So anytime that someone suffers a concussion and then suffers a second follow-up concussion within the next days or weeks, this can be a very serious injury and is almost significantly more likely to lead to post-concussive syndrome because there's something going on that's not fully understood at this time, as this research is very recent, that leads to such a disastrous outcome of the second concussion. This is a big part of why sporting events are starting to take concussions much more seriously because for football, for example, the concussion itself is not the serious risk. It's the follow-up concussion. It's the follow-up brain impacts that occur after the initial impact that can really create trouble for someone who's already suffered one brain injury. This actually has been studied a lot over in Iraq on American soldiers who were doing things such as bomb displacement or that had already suffered one concussion. And the overarching conclusion was that people who've already suffered one concussion need to be treated very fragilely, allowed to sleep, kept away from lights, and just can't be sent back in, which was a very old mentality of, oh, it's just a brain injury, you're going to be just fine. You just had your bell wrong. And thankfully, things are really quickly changing. Kind of turning from that to the last part of this presentation, which is post-concussive syndrome. This is the most rare but most impactful post-concussive long-term implication that we're going to talk about today. I would like to quickly touch upon, there's a couple other things that aren't in this presentation that'll be in one of my later presentations, and that's the increased risk of dementia, Alzheimer's, and other late in life debilitating injuries that can occur after a brain injury, or specifically after 2 brain injuries back to back. These types of risks, I'm going to talk about them all in their own video, so stay tuned for that. Kind of switching to post-concussive syndrome, it really is as simple as it sounds. It's just when the symptoms of a concussion, which we talked about before, headaches, dizziness, nausea, you have it, when those don't dissipate after weeks or months relative to how long it should take for them to dissipate. For example, cognitive symptoms tend to resolve themselves within a few weeks to a month after a concussion. However, certain more deep-rooted issues such as balance concerns, these can take longer for the body to adjust, and memory issues are another one that can take up to 6 months. But in many people, about 10 to 15% of folks who've suffered a brain injury, one or more of those symptoms will either take significantly longer than expected, which can be years, to resolve, or ultimately never resolve. And unfortunately, that's true of many of the clients we represent, because those are it's the unseen injury within concussion. These 10 to 15% of people, their lives will never be the same. And it's very heartbreaking, but it's far more common than I think people believe. Again, that's 10 to 15% of people who've suffered a concussion. And with secondary impact syndrome, this number can be much, much higher. So that's kind of the serious discussion involving the long-term implications of a brain injury. As I discussed, some of these symptoms that I was just mentioning that are associated with post-concussive syndrome, we also have a checklist that demonstrates all of the many symptoms associated with concussions. This checklist is available on our website. You can click the link associated with this video if you'd like to, if you know someone who you fear may have suffered a brain injury. And as always, I hope everyone is safe out there, and I wish you all the best. Thank you.